Welcome to Making Maverick Moves, the podcast where bold thinking fuels brave leadership. I'm Gina L. Osborn, and today we're talking about transformation, not just the kind you see in the mirror, but the kind that starts from within. My guest is Dr. Dawn Mowlds, the Orange County plastic surgeon whose viral work with Real Housewives star Tamra Judge sparked a fierce online debate about beauty, aging, and choice. We'll talk about why people make bold changes to their appearance, the risks and rewards of plastic surgery, and how owning your image can be the ultimate maverick move. My name is Gina L. Osborn, and I'm an Army veteran. I spent 6 years during the end of the Cold War as a counterintelligence agent. I was appointed as an FBI agent, and during my 22-year career, worked everything from Asian organized crime to terrorism. I became the assistant special agent in charge of cyber and computer forensics. And then I came out of retirement and spent 2 years as the safety and security officer at LA Metro. Now I'm here to help you make your maverick move. Welcome to the show, Dr. Mowlds.
Thank you. Thanks for having me.
Well, the first question I want to ask you, because this is kind of the viral moment when Real Housewives of Orange County, Tamra Judge, had a blue peel and what did she have?
Brow lift.
Brow lift, yes.
With a little CO2 sprinkled in there.
Right. And everybody went nuts on social media because they could not understand why she would do something like that. Yeah. So I wanted to bring you here so you can kind of debunk the myths of what exactly happened and tell us how we can look our absolute bests.
Yeah, so when it comes to skincare, you know, at the age of 30, we start losing and stop producing collagen, and we lose about 1% per year. And I learned my skincare stuff from Dr. Obagi, who invented the blue peel, which is nothing more than a trichloroacetic acid or TCA acid peel that's combined with blue dye so that we can see the depth of the penetration of the acid, which improves the safety. So you want to get down to a certain depth to get improvement, but not too much that you create a problem. On top of that, you do CO2 laser to stimulate the collagen so you get maximal benefit of what you're doing. The problem is it hurts. So typically for that procedure, I'll put people to sleep or do twilight sedation to help them. Now, it produces a ton of inflammation, and that's what everyone saw was the rapid swelling compounded by the brow lift swelling. So the combined effect of both of those was pretty dramatic and made for a viral moment.
It really did. And what shocked me was the comments that people were making and how vicious people were, because they were looking at it as if it was such a painful procedure. Why would she put herself through something like that?
Interestingly, the peel and laser itself afterwards are not painful. The swelling is painless. It's just a thing that takes a week or so to go away. The brow lift, you have 24 hours of a headache, but after that, fairly pain-free. But it is dramatic, but the combined effect really gives a natural improvement, long-lasting rejuvenation of the skin. It gets rid of fine lines and wrinkles, pigmentation, and stimulates collagen at sort of a maximum level to jumpstart the skin again, return that collagen production, and create, a smooth, nice result.
So I've had CO2 peels before, and back in the day I had TCA peels, and those were really, really crazy. So is it safe to say that it looks a lot worse than it feels?
I've never had it done, but that's the reports I get.
Right. Because essentially all of the pigmentation rises up to your skin, and then it all peels off. And how long does it take in order to get through that procedure?
You're healed in about 10 days. So I try to target it for it's the 7-day mark. You're about 80% healed.
Okay.
And so from there, there's a few spots that need to still peel off. You're pink for about 2 weeks. You can resume your skin regimen about a week later, and then at that point we want to still stimulate the collagen growth to keep the result getting better and better.
So did you talk to her about how this whole thing went so viral and
A little bit, because it was very unplanned. Mm-hmm. I saw her post a photo of everything all wrapped up, and I thought, okay, you're nice and blue, here we go. But yeah, I kind of saw a lot of mean comments, and I felt bad. I called to check in and said, "Are you okay?" I mean, I'm feeling bad. are you feeling okay? And she said, yeah, well, it's part of the territory, which kind of gave me a peek behind the curtain of what the reality stars have to deal with. And
Right.
It can't be easy.
Yeah, it can't be easy. And I think it took a lot of courage to be able to share that with people. But again, who are the people who appreciate the comment or the posts probably aren't the ones who are making the comments, I would imagine.
Hard to say, but peeling back the curtain a little bit on healing and the process of plastic surgery, and it's not always talked about. We put our patients if they ask to, their preoperative photos and then their after photos 6 months, a year down the road. So you really don't see the time period in between, which is an important part of educating patients that are looking to make a change in their life or do something different with their appearance. They should know all the steps and be able to make an informed decision about what's right for them or what's not.
Sure. So in light of everything that's going on, all of the social media posts, everyone wants to look their best. And people are actually, they're aging and the 70s are the new 50s, right? So people are living longer. Mm-hmm. So what has it been like in your industry with all of these people who absolutely want to look their best all the time?
It's certainly driven our business more and more every year. I think there's a lot of misinformation that gets passed around, unfortunately, and that's a big topic of conversation in our society, is how to properly educate patients on what's right, what's not. Because oftentimes we have patients that come in and they sort of self-diagnose. They say, I want this, I know I need this, X, Y, and Z. And you say, well, let's back this up and kind of figure out what works for you. And the answer may be nothing. Mm-hmm. It may be that kind of what you're looking for, there isn't a true solution, even though you might have seen something like it on Instagram or social media. So I think it's really important to pick providers that you trust, that you can go in and have an honest conversation with and figure out what's the right thing for you.
Are you seeing younger and younger people coming in for facelifts and brow lifts and all of the other things?
The demographic for the facial procedures has shifted to a younger, more, call it preventative is the word that's thrown out there. I want to do a preventative X, Y, or Z. Well, preventative surgery, unfortunately, is it tips the balance of risk and benefit for a lot of providers. But things that you can do preventatively is stimulate the collagen in your skin, wear sunscreen. Some people will start Botox at a younger age, or the neurotoxins to help with wrinkle formation. Those kind of things I think are appropriate for younger folks.
Sure. And Botox has been around for a while. Are you saying that the people who started earlier are needing less work done?
Again, hard to say. I think it really comes into where I see when people come in their 50s, 60s and want facial rejuvenating procedures, the folks that have paid attention to their skincare really have a good result because they have the collagen, they have the elastin, they have the tension that they're in their skin to withstand the surgical forces and create a long-lasting result. And those people uniformly get a better outcome.
So those people in 50 or 60, how many facelifts? And I know I'd say how many do they need? And we all know that we don't need any of this stuff.
No.
But are you one and done when you go in your 50s or 60s? Or is there an expectation that if you want to maintain that look, you're going to have another one down the line?
Yeah, there's a natural relaxation and aging to the skin that happens no matter what, and it has a lot to do with skin structure, the way your bones age and rotate as we get older. I say it like this. The facelift will give you some years back, and then you'll continue to age, and whether you get to a point where those signs of aging bother you again, then that's great. Then come back and we can talk about if that's the right thing for you. But it may be that this is just what you needed, and as long as you maintain a healthy weight, healthy lifestyle, skincare, you can get a facelift result to last a super long time.
Wow. Yeah. And then if you're in your 30s or 40s coming in, is that something, if you get it younger, is there benefit to that? You talked about the prevention. What are your thoughts on that?
I don't know. I go back and forth. It depends. Now there's some conditions of the neck that are genetic. And for those people, a younger treatment strategy is probably warranted. the way the muscle attaches in your neck gives kind of a fuller appearance in photos as we enter our 40s. And those folks do benefit from it. But small little, loose skin situations, probably going through a big surgery to create improvement there. It's something to talk about, definitely.
Mm-hmm. And what are your consultations like? I know that you don't charge for your consultations, and you're in Fashion Island in Newport Beach.
Yep.
So how do those go? Like whether you're young or you're old? I mean, talk a little bit about what the misconceptions are and what your advice to people are before they even consider doing something.
My advice, I always say I'm like the worst salesman. When people come in, I'm like, well, what do you not like? You tell me. I'm not going to tell you. Because every now and then I get someone, well, what do you think's wrong with me, and what can you do about it? I'm like, nothing. Mm-hmm. Everybody's perfect the way they are. But I would say the big thing to do is separate what you objectively would like to have changed from your happiness. If you're coming to think that I need to do this surgery and I need to do X, Y, and Z, and then I think maybe I'll be happier, you got to be careful there, because the reality is that's probably not going to make you happier. And so I really try to get into that during the consultation is what brought you here? What really brought you here? Was it the way a bathing suit fit? Was it a comment someone made? Is it just something you've always thought about? Is it functional? Mm-hmm. Those types of things are very reasonable. But if it's, I don't know what it is, I'm just unhappy, I want to be happier, well then I'm actually might be making it worse. Mm-hmm, mm-hmm. So that's important to
figure out.
Yeah.
And so what do you think about when people are telling you their story? I mean, do you have to be convinced to actually do the surgery? I mean, where's the line that you draw that maybe this person might be addicted to plastic surgery, or maybe they're doing it for all the wrong reasons?
Yeah, I think it's, we both have to agree on what we're trying to address. If it's very, just from an objective standpoint, is it, for instance, is it heavy eyelid skin? I see it, you see it, it bothers you. Taking it away would definitely look better, and that's what you want. Then we match up. Mm-hmm. We have a match, and I have something that I can provide, a service I can provide to you that's going to correct what we both objectively see as the issue. Mm-hmm. The problem comes in when I don't totally understand, and I don't feel like the patient understands what I'm saying, and I don't feel like there's a correct, what we call, informed consent procedure. Like I haven't conveyed the information appropriately, and I don't think they completely understand what we're doing or how we're going to do it and how it might benefit them or what the risks might be. Mm-hmm. Nothing's perfect. Mm-hmm. Mm-hmm. And so that's when I kind of take a step back, and it's for everybody's benefit.
Sure. No, and I think that's wise. I mean, and that's definitely ethical, because I don't think everyone who walks into your office needs to have the procedure if they're going in there under the wrong reasons.
Yeah, and some of it is just giving more information. Mm-hmm. And that's why I don't charge for a consult. I think everyone's entitled to information, and if I can help in any way, that sometimes that's helpful too.
Yeah. And so you talked a little bit about misconceptions. What are the biggest misconceptions about plastic surgery?
That's a good question. I don't know. I guess that it makes you look unnatural. Mm-hmm. I think that's one thing that people come in as they say, well, I want this, but I don't want to look like X, Y, and Z. So what makes you think that might be a potential outcome? Mm-hmm. So I think that you don't necessarily need to think along those lines. Now, there is some plastic surgery that can make you look unnatural. Mm-hmm. And for some people, that is their goal. Mm. But definitely, by and large, plastic surgery does not make you look unnatural.
Mm-hmm. If it's done correctly.
If it's done correctly, and like I said, if you correctly identify the problem and you correctly create a treatment solution, a surgery to fix that, it should be corrective and restorative, I guess is a better word.
Right. Yeah. So what are the biggest risks going in?
Biggest risks are mismanaged expectations. Mm-hmm. We kind of talked about on that. Health issues. So we look really closely at what are your health issues. Do you have high blood pressure, diabetes, heart disease? Can you tolerate the surgery? Can you tolerate the recovery period? Do you smoke? Smoking is very bad for healing. Mm. And especially in the plastic surgery sense of surgery. So a lot of people say, well, I smoked when I had my appendix removed and I was fine. Different.
Wow.
So we really... it all has to go into the blood supply of how things heal. So we really want to make sure you heal well. So really taking stock of what about you would make you a good candidate for this surgery to make it go well. Mm-hmm.
And how, because I mean, vanity is probably driving a lot of this. So how often are people really happy with what you've done? And we don't have to say what you've done. Overall, what plastic surgeons do, and how many people aren't happy? Because, you know, you hear all about being, you know, someone being botched or what have you. And I think that in and of itself is a risk if you go to someone who may not have all the certifications necessary to do the procedure. But I mean, are people generally happy with the results, or how does that work?
I think so. And it goes back to managing the expectations, right? Everybody's, and that's where social media can be to the detriment, is you see the pre and the post and you want the post, but you may have not been like the pre. So achieving the post picture and just stamping that on everybody is a little unfair. So really, it's my job to manage those expectations, and that manages the happiness post-operatively for the most part. Now, things don't always heal well or go well, and that's just part of doing surgery. So we all see patients who had surgery from another surgeon, and the patient would like things to be different. Not necessarily that surgeon's fault, although sometimes there are some things that, like you said, where they're not certified properly. But for the most part, you're trying to get the most complex thing on earth to heal exactly perfectly after you do elective surgery on it. Not always going to go perfectly for one reason or another. And so those are where you step in as their doctor and say, you know, I'm your doctor first and I can help you. Sometimes that faith is lost and people go to other surgeons for help, and that's where we all exist as a community to get the patients from A to B.
Sure. What are the riskiest procedures? Because I hear like the Brazilian butt lift. You hear a lot about that being a risky procedure.
So that one really came into light because patients were dying, and I think it was at one point quoted around 1 in 3,000. And the reason is when you take fat from, so the Brazilian butt lift procedure, what is it? It's you take fat from somewhere else in the body and you inject it into the butt region to create a better shape, more projection, just in lieu of putting implants in. The problem is just deep to the muscle in the buttock region are big veins that go back to your heart. And so some of that fat was inadvertently making its way back to the lungs and heart and causing people to die.
Oh my gosh.
And so there was a big caution statement put out by our society and temporary moratorium on some of these larger procedures. And since then, there's been a lot of safety protocols put in place to prevent this ultrasound-guided fat transfer to stay out of those danger areas. But that's, traditionally speaking, technically the most dangerous procedure. If done safely, it's not, but that's just where all that came from.
Right. And what about the procedures that have to be redone? What would those be? Or the patient feels that they are not satisfied with those. What do you think is the hardest thing to fix?
Hardest thing to fix are probably minor imperfections in like a facelift, because it sometimes requires a big surgery to then address those. And a lot of it goes back to the skin quality before you even did the surgery. Breast surgeries, you know, that's a sort of an anti-gravity procedure. So everything all day long, gravity's acting against you. So depending on their skin quality, you know, the way the implants and everything settle really depends on that. And so that's a common procedure that is redone eventually. Not always right away, but eventually you have to, gravity always wins.
So how did you get into this? Did you always want to be a plastic surgeon, or what? How did you get into this role?
You know, honestly, I wanted to be a professional golfer.
Oh, okay.
And when that wasn't looking like it was going to happen, I knew I liked math and science, and I might want to be a doctor. So I went to a college where they allowed me to play golf and do pre-med.
Which college was that?
Brown
Okay.
University. So I went there, and then my grandfather, who was an attorney in San Francisco, said, well, I do some work with a group that supports a philanthropic hospital in Guatemala, and a team of surgeons from Stanford and Kaiser in San Francisco go every year. Would you like to go? I thought, well, yeah. So long story short, I went down there 3 times and always looked in the corner and saw the plastic surgeons doing these really creative, interesting procedures. And that sort of drew me to it. Went to medical school, palled around with some plastic surgeons, did a bunch of research, and here we are.
And here you are, and you're married to a plastic surgeon?
I am.
How does that work?
It works well.
Yeah?
it's hard to leave work at the office. And you go home and you talk about your cases, which is helpful. Get each other's input, but we definitely very much take work home, and it exists 24 hours a day.
I'll bet.
Between us. So
I'll bet you do.
But it's been fun.
That's great. And you're partnering with Dr. Ambe, who is just so esteemed here in Orange County and probably known throughout the world for.
Fantastic.
Yeah. So how did that come about?
I was looking to expand my practice and looking for more space. And honestly, we play golf at the same golf club, and our lockers are next to each other. And one day he said, "Hey, I built this big office, and I have a lot of space. You wanna come join me?" I said, "Yeah, sure." It was as simple as that.
Yeah. That's terrific.
That's great.
Terrific.
He's such a great guy. Yeah.
So what do you see down the line? How do you see your profession evolving in just based on where the world is going?
I think we'll always try to refine our surgery techniques and how we're addressing certain problems. That's the topic of a lot of meetings. I think there's going to be a lot of science and energy put into the non-surgical side of how to heal people better, how to rejuvenate skin, and a lot of the manifestations of that we see a long time, how to manage people's weight, how to manage all these things, I think is going to be the next frontier of this specialty, and where it's going to cross over with dermatology, those types of things. But I think that's definitely going to be big. You hear about exosomes and the PRP and the stem cells and all that's a huge frontier that's just now beginning.
Do you think you'll be working with that?
I'd like to.
Yeah.
I've still maintained a element, as you've seen with the blue peel, and skincare, but because I believe that people should be given non-surgical as well as surgical options. Yeah, definitely.
So if you're a young person and you want to do everything that you can to put any sort of surgeries off as long as you possibly can, assuming you are interested in looking your best, what should someone be doing right now?
In your 20s, wear sunscreen. Honestly, I mean, the sun damage effects are cumulative, and you don't know how many people I see in their 50s and 60s, and they say, "What are these brown and white spots that happen?" I said, "Unfortunately, that's probably from when you were burned 30 years ago." So wear your sunscreen, reapply it. When you get to your 30s, you start looking at how can we stimulate the skin, retinols, tretinoins, those types of things that really stimulate the collagen production, the elastin, sunscreen, and maintaining good oil control. Think about lasers in your mid-30s that stimulate the collagen, take you to that next level, really keep things improving long-term. And then, 40s, 50s, look at the parts of your face that you may want to change. Is it the eyelid skin? Does it make you look tired? Is it jowling? Is it small little things that can be corrected with fillers or Botox?
How do you feel when people come in and they say, "I want these great big giant lips"? Do you try and talk them out of it, or do you try to accommodate them?
I just say I might not be your person.
Yeah.
And so, yeah. And that's where social media can help within our practice, is you sort of, over time, you put out what you like to get back. So people then see your aesthetic. They see what you do and the absence of what they may want. So they may go to someone else, which is totally fine. Everyone has their own thing that they like doing, and there's someone for everybody.
Yeah.
And I just say, I might not be your person. I just can't envision that, and hear some people that do that.
Yeah. Yeah. I just wonder, what can we do with this generation that is so obsessed with the way they look? And I'm sure 20 years from now, because you're still young, you're going to be still working, I'm sure, in 20 years. I mean, what do you see in the future with this particular generation? What could we be telling these people, that you're okay the way that you are?
I think the message has got to come from the sources that they idolize. Everyone looks up to someone. I looked up to Freddie Couples, the golfer. If you're listening, let me know if you want to play some golf. But that was my idol, and he was so cool and calm and collected and well dressed. And I thought, well, that's who I want to be. And so I think it comes from the people they idolize, and and whatever that may be. Are they influencers? Are they celebrities? And movie stars, actresses, actors.
Yeah.
I don't know.
But it seems those people are all leaning towards the plastic surgery side.
Yeah.
And and I think, like you said, to be able to prevent it before you get to the point where you're not happy with the way that you look. Because I know, I was at an event at the Council of Aging, and the president of this council was talking about how she just had a conversation with a woman who was 109 years old.
Yeah.
So we're going to be living a lot longer. So, what does that look like? And what does that look like in your profession when it's going to be normal for people to live into their hundreds?
Well, I think that's an important word, is living. We want to make sure we're living and not just existing.
Right.
And I think that's what people are starting to they're starting to focus on, like, how can I be my best? And I like hearing that. When someone comes in and says, I'm just looking for advice on how to be my best. And that's where I really steer people down the non-surgical stuff first. How can you be your best skin-wise, or minimize wrinkles, do some lasers? Because surgery, I'm not going to change who you are. And if you want to be a different person, that's not going to make you happy. But how can I be your best? Well, we need to start down this journey together at A and get to B. So the sooner we start down that journey, we can understand how you're aging, makes it easier.
Sure.
But definitely, I think start small, instead of people come in and they say, I saw this person, I want a facelift, and I'm 32. Well, it's not going to help you from aging. It's not going to help you live longer.
And I think it's just kind of a mind shift. My mom is 86. When she was 85, her doctor told her that she had to use a cane. And I don't want to say exactly what she said because I don't want to use profanity, but she said she's not using an effing cane, right? So I said, then you have to go to Silver Sneakers. And she said, well, I'm not going to Silver Sneakers. There's too many germs there. So I connected her with a private trainer. And she's been at 86. She's working out 3 days a week with a personal trainer, lifting weights. And she started with stick legs, and now she's got muscles on her legs. So how important, we always hear about eat right and exercise. But, when you look at longevity and the way that you look and the way that you feel, how important is the eating right and the exercising as far as a prevention tool?
100%. And mobility. I think a big thing that I found even helpful for myself, because I had back pain, neck pain from surgery and all these positions and stuff. And so I went and sought out someone that would help with stretching and mobility, pelvic mobility, leg, hip, and I have no more back pain. I walk longer. I walk straighter. I'm stronger. So I think that's something, as we work in our jobs longer and we live longer, paying attention to mobility and strength is going to be the key to living longer, not just existing longer.
Exactly. Thriving 100%. Longer.
Yeah, thriving longer, keeping your weight manageable. Easier said than done.
Sure.
Easier said than done.
Well, you talked about the doctors that you saw in Guatemala. So I don't think people really realize what the other side, versus the cosmetic versus the amazing things that plastic surgeons are doing to help people. Do you want to shed some light on that?
Yeah, actually, the plastic surgery that everyone knows about is such a small part of what this specialty does. The specialty, as it developed, was sort of a waste basket specialty that specialized head to toe. Actually, the first kidney transplant was done by a plastic surgeon. But it really, the whole mantra is to restore form and function to people. And if you think about it, that's fairly true of cosmetic surgery, but also, you have car accidents, skiing accidents, cancer reconstruction, head, neck, leg, arm, breast. All that stuff is a very big part of plastic surgery. We have craniofacial surgeons that treat kids and deformities, hand surgeons. A lot of them are plastic surgery trained. So it's a really broad field, and that's initially what drew me to it, was you can kind of do a little bit of everything, become a master of the entire body, and that's pretty cool.
That's exciting. Yeah. And there's so many new things coming out every day on how you can help people. I think that's fantastic. Yeah. So one last question. I would be remiss if I didn't bring up Kris Jenner, who looks phenomenal.
Yeah, that's great, huh?
Assuming that this isn't just lights and photoshopping, how does someone of that age group totally and completely restore their youth the way that she has?
It's I don't think it's just lights.
Okay.
I think if it is all we read is what's in the news. I don't have any extra insight, but the surgeon that did her surgery is a fantastic surgeon. I know him, and he does a good job, a really good job. And, having a natural result on a skin and bone structure that's well kind of formed. I mean, she doesn't have a heavy face or neck. She has good skin care. All those things we talked about really lend to a nice and a good surgeon. All those things lend to a really nice result that looks natural. It moves naturally. It looks good in all light, and that's the key.
Okay, I
and
like
well
that.
Worth all the time and energy she spent.
No kidding. Well, she's a walking billboard for her surgeon, for sure.
Yeah, definitely. Yeah.
Well,
fantastic.
Yeah, this show is called Making Maverick Moves. My real last question is, how do we have to feel about ourselves in order to make those maverick moves? And how much of it is just liking who we are and how we look?
At the end of the day, being comfortable in your own skin as it exists, loving yourself for who you are, having a good support structure around you, I think is the key. And unfortunately, I'd love to, but I can't do that for people. And I think that comes from within. And it's something we all have to look deep and handle.
Yeah, those are words to live by. Thank you, Dr. Mowlds, for being on the show.
Thanks for having me.
Making Maverick Moves with Gina L. Osborn is produced and edited by Zill Media. Connect with us on social media at ginalosborn.com/Making Maverick Moves. Don't miss an episode. Subscribe to Making Maverick Moves wherever you get your podcasts.